Ebola has found its way to Boston, and President Obama says doctors may have found a vaccine for the deadly virus. All that and more on this WEBN Ebola special.
Hello and welcome to this WEBN Special Ebola Alert. Alongside Mike Lucas, I'm Gabby Kula.
The majority of the Ebola outbreak has occurred outside of the country, but now the virus has found its way close to home. A patient with Ebola-like symptoms was admitted to Massachusetts General Hospital on Tuesday, but the virus had not yet been confirmed. The patient is being examined after showing symptoms because he was possibly exposed to the virus while traveling to an area where Ebola is present. This is the first patient admitted to MGH with Ebola-like symptoms as a precautionary measure. Doctors treated the patient in full-body protective gear called moon suits to eliminate any chance of the virus spreading. Dr. Paul Bittinger spoke about the hospital's decision to admit the patient.
The patient is in stable condition and in good spirits. We feel extremely confident that all of our patients, all of our staff, all of our visitors are perfectly safe. There is no concern, no matter what the outcome of this ultimate clinical investigation will be.
The Massachusetts Department of Health put out a statement reminding the masses that there are no confirmed cases of Ebola in the state.
The largest outbreak of Ebola occurred in West Africa earlier this year. The symptoms of the virus include fever, severe headache, muscle pain, diarrhea, vomiting, and unexplained bleeding or bruising. Ebola is spread through direct contact with an infected person's blood, bodily fluids, or needles and syringes that have been infected. It cannot be spread through food, water, or the air. It can take up to 3 days for a person to feel the symptoms of the virus. Ebola is difficult to diagnose in its early stages because the symptoms, such as a headache or fever, are very nonspecific. However, blood samples can be collected and tested to confirm the virus. Joining us now is our virus correspondent, Zoey Lorenzis. Zoey, where is most of the Ebola outbreak occurring?
Thanks, Gabby. Ebola has reached over 10 countries on 3 continents. As of October 24th, the deadly virus has reached 6 African countries. The CDC reports over 5,000 deaths from Ebola in this area, with a total of 15,000 cases. However, the World Health Organization believes these numbers to be vastly underestimated. The CDC report also states that the outbreak has occurred mostly in Sierra Leone, Liberia, and parts of Guinea. Nigeria was declared Ebola-free on October 20th. However, there were 7 confirmed deaths from the disease. In Europe, the affected areas now include Norway, England, Spain, France, and Germany. There is 1 confirmed death in Germany and 2 in Spain. In all other European countries, Ebola patients were treated and released. In the United States, Ebola has reached Texas, Georgia, Nebraska, Maryland, and New York. 1 patient died from the disease in Dallas, and 1 died in Omaha, Nebraska. Both patients spent time in West Africa treating Ebola patients. There are currently 2 patients undergoing treatment at the University of Nebraska Hospital, which has the largest biocontainment unit in the country. On December 1st, Massachusetts General Hospital reported they have a patient under investigation for the Ebola disease. Let's go back to the desk to hear about another Ebola case close to home.
Not long ago, Casey Hickox was fighting Ebola in West Africa. Now, she's fighting a very different battle in her home state of Maine. Department of Health and Human Services Commissioner Mary Mayhew wants Hickox to undergo a 21-day quarantine, but the doctor isn't having any of it. Hickox says if the restrictions aren't uplifted in the next few days, she'll take the state to court. She volunteered in Africa with Doctors Without Borders and was the first person forced into New Jersey's mandatory quarantine after leaving a plane that landed at Newark International Airport with passengers from multiple West African countries. Hickox says she has no symptoms of the virus, and here's what she had to say about the quarantine.
I'm not willing to stand here and let my civil rights be violated when it's not science-based.
As it stands right now, there is not a cure for Ebola, but that could change in the very near future. Earlier this week, President Obama praised healthcare agencies on their work towards creating an Ebola vaccine.
So last week, just in time for Thanksgiving, NIH and your partners gave us something new to be thankful for, and that was news of the first successful step, completion of the phase 1 clinical trials of a potential Ebola vaccine.
The vaccine is currently undergoing a review process to determine whether or not it's harmful. It's the first of 3 phases it has to go through before it can be administered. The results as to if the vaccine actually helps prevent Ebola are still inconclusive.
While the United States may be close to a vaccine, Africa is not. A fifth local doctor in Sierra Leone has died of Ebola. Dr. Godfrey George, the medical superintendent of Cambia Government Hospital in northern Sierra Leone, passed away on November 3rd, according to officials. More than 13,000 West Africans have been infected by the virus, including over 550 medical officials.
That's all the time we have on this WEBN Special Ebola Alert. Alongside Gabby, Kula, I'm Mike Lucas. Stay tuned, stay healthy, and have a great night.